Welcome to the continuing series of South Florida Hospital News leadership interviews and videos. These are conversations with leaderships of hospitals and other healthcare providers within the South Florida market. And today we have a very great guy that I've known for a while now. We've been trying to get him for a while to come on. Finally, we're able to wrestle him down again. Dr. Rodolfo Blandon from Cleveland Clinic, Weston. And welcome, Rodolfo. And it's good to see you.
Thank you, Charles. Likewise, thank you for the opportunity to chat today.
We've done this now probably about 35 times with different CEOs and kind of talk about conversations of what's going on in your life. And basically, we have a lot of people who watch these are what I would say early careerists, mid careerists, who want to know a little bit about your career, and then those who really just want to know a little bit about yourself and Cleveland Clinic Weston. So, with that, kind of tell us the position you currently have with Cleveland Clinic Weston, Dr.
Sure,
Blandon.
Charles. Yeah, so I'm Rodolfo Blandon, and I currently serve as the president of Cleveland Clinic Weston Hospital in Broward County, and I oversee not just the hospital, but also the 8 ambulatory facilities that we have throughout Broward and West Palm Beach. I also maintain my clinical practice as an interventional radiologist.
Oh, very good, very good. So basically, you're busy from administrative to clinical.
Absolutely. These days, Charles, I do more administrative work, as you can imagine, but
Sure.
I really enjoy my clinical activity.
Well, tell us a little bit about your family and how they handle all this.
So, I'm very blessed, Charles. I'm married to another physician.
Oh
Uh,
my goodness.
yeah, so I have 3 beautiful and smart daughters, 3 women ranging in ages from 5 to 24 years.
Hmm.
So I have a daughter in law school, one in college, and one who just started kindergarten.
Well, you run the gamut of children. Then it's a good thing. You have
Absolutely.
these you have experience behind you, which is always a good thing.
They keep me busy.
So everyone has a different educational path that they've taken to achieve the level of senior leadership within healthcare organizations. Tell us a little bit about your educational path.
Sure. So, Charles, I did my college education locally in Miami, Florida International University, where I obtained a bachelor's in science in biology. Then I was lucky to I did my medical career, my medical doctor degree at the University of South Florida in Tampa.
Hmm.
Uh, and then from there, I went to the Northeast for more education. I did a year of general surgery where I completed my internship in Pennsylvania at the Medical College of Pennsylvania, in Philadelphia. And then my radiology training I did at Allegheny General Hospital.
Oh, okay.
My last stop was in Washington, D.C., where I did my interventional radiology fellowship. So that completed my medical career. But most recently, I also obtained a master's in business administration from the University of Florida.
Well, I would say that that's a great thing because running a facility like Cleveland Clinic Weston, you need that business background along with the clinical and understand the clinical background. So it looks like you've checked off all the boxes at that point.
It's been pretty hard
So,
for sure.
so from there, so now the education. What about your career? Where did you start out at? How did you wind up to where you are today?
So I am unusual in the sense that I have been working at Cleveland Clinic for the last 21 years. All of my career, I have been at the clinic, and I have been very lucky in that many folks have supported me throughout my career. I began as the section head and vice chair of radiology in the year 2001. Soon thereafter, I was asked to be chair of the department of radiology. So I was able to grow that department for 18 years. And after that, I became the center director for the hospital, where I manage operations in pathology, the emergency department, anesthesia, and radiology. And then in 2016, I became the chief of staff for the facility. And in 2019, right before COVID, I became the president of Cleveland Clinic Hospital and has been having that role ever since.
Well, you came in at a good time to be president, no question. So during your career, there had to be major challenges that you've run into, especially dealing in one facility, different people, different situations. Uh, can you tell us a little bit about some of the major challenges that you faced as you progressed during your career?
Yeah, absolutely, Charles. So really throughout my journey, as you've seen, most of the time I've had an administrative role. And one of the challenges that I have always faced is finding that balance between being a physician executive and a clinician. I really enjoy both tremendously. And, being able to multitask is always, one of the biggest challenges that, a basic clinician and physician executive can have, because that when you come in, but you don't come into work, but you don't know what you're going to face that day. So the constant multitasking in dealing with the unpredictability of the workday is definitely one of the challenges. If I look at a period of time, though, definitely the most challenging period of time has been the COVID pandemic. And I think that no matter who you interview, they're likely going to say that. Sure. When we were faced with uncertainty, leading a group that everybody was afraid, we didn't know what we were dealing with. That put everybody to the task of uncertainty with the COVID pandemic.
Do you think, I know Cleveland Clinic, their executive staff are all physicians?
Correct.
For the most part, all physicians. Do you think that gave you a better understanding of problems relating to COVID, for instance? Not all problems relating to a healthcare organization are necessarily healthcare. They could be situations relating to collections or staffing and that type of stuff. But COVID was truly a medical issue that obviously involves staffing and that type of stuff. But do you think you had kind of a little bit of an advantage from having the degree of a master's degree in business and also the medical degree? Do you think that gave you a little bit of a head start to a certain degree?
Absolutely, Charles. There's no doubt about it. And that you get that when you have that formal training gives you a different perspective, because at least when I went to medical school, the training is just medicine. They don't teach you anything about a business. And I think that when the CEO or the president of a facility is able to have both levels of knowledge, then it can lead to leading teams to making the best decisions for patients, which is always the goal. Now, at Cleveland Clinic, as you pointed out, typically the highest ranking officer is always a physician, but we are surrounded by great talent of our administrative partners. And we really have very collegial partners working in teams where every caregiver, everyone's voice is heard and taken into consideration.
I think that leadership physician business model seems to work great for Cleveland Clinic and other facilities that are physician led. So
completely
that's good. So in a day, or let me kind of back up a second. During your path or your career, from medical school throughout residency, working with Cleveland Clinic, you must have come across a few people that you could kind of look back for that are always the voice in the back of your head, mentors, that you hear that voice almost all the time. Who were some of those mentors, whether it be name or position or just in general, that basically got to you, that made you what you are today?
Boy, that's a tough one, but I got to tell you, definitely a few people come to mind. The Institute chairs of the Cleveland Clinic Enterprise for Radiology, the two of them that I worked with definitely have been incredible mentors to me. The first one gave me the opportunity to lead radiology when I was only in my mid-30s, and most of my staff members were much older than I was. And he had the trust in me to be able to lead the department. And it all started out that I was just out of training, and one day he says, Rodolfo, I think you're the best leader to lead this growing department in Weston for radiology. And I said, well, what do I do? I just got out. I thought I was just going to do interventional radiology. And he said, don't worry, you'll get this. We'll talk every Wednesday, and you let me know your updates, and we'll take it from there. So, we had a series of Wednesdays where we chatted about administrative issues, till one day he said, you know what? You don't need to ask me for any permission anymore to do anything. Just call me for apologizing when you make a mistake. Got it. just lead. And that's how it really started. But really, Dr. Greg Borkowski, who is the chair of the imaging enterprise for all of Cleveland Clinic, has been an amazing mentor to me. And I have also been blessed of working with prior chief executive officers here at Cleveland Clinic. And I've been very lucky to work with them and learn from them. And what I always try to do is learn their best skills to integrate them into my own leadership style.
Right. That's great. That's wonderful advice for people that you need to take not all the pieces, but some of the pieces that fit to your style. So and again, I've been told that there's never a typical day in healthcare, and I'm sure there's not. But what does a day in Dr. Blandon's day look like in Cleveland Clinic? What does it look like a typical day?
So Charles, was very consistent with my day is that all the leaders attend what we call the tiered huddle process. So my day begins with an operational update of what's going to happen that day throughout all our sites. And then we have a second huddle where I learn anything that has occurred to patients in the last 24 hours related to quality, safety, patient experience, operations, and volumes. So all the key leaders of the organization get together and we address all the issues for the day. So that's pretty consistent. In my day, it usually starts with the huddle process. And by the way, this goes all the way to the Cleveland Clinic Enterprise CEO. By 11 o'clock, every leader in the organization knows all the key issues throughout all our facilities throughout the world at the Cleveland Clinic.
Wow, that's wonderful. That's a wonderful way of doing it.
Yeah, and we all learn best practices from each other when we do that. And that's what's predictable. The rest of the day, Charles, is unpredictable.
Right, exactly. You never know who's going to be knocking at your door or waiting at your door.
That's exactly right.
We all go through that. So tell us, in the past year, where we're getting hopefully towards there may be a light at the end of the tunnel per se, but with the COVID situation, what has you as an individual, Cleveland Clinic as an organization, what was the best things that came out of better operational ability that came out of COVID?
Yeah.
Not the negative, but what happened during those period of times, things that you've done that are making Cleveland Clinic a better organization today?
Yeah. Well, Charles, as we alluded to earlier, definitely, the pandemic has changed things, but it definitely showed one thing, that at times of adversity, when teams get together, they come up with solutions, even in the unknown. Everything is possible if one really works as a team. And I can tell you, when we didn't know how many patients we were going to have, we didn't know if we were going to have a surge of patients that we couldn't manage. We really got together to get prepared to make sure that we had the staff, the supplies, and the space. If suddenly we had more patients to take care of than our usual capacity. And, we were ready for that. Locally, we were always blessed with the 3 S's: staff, supplies, and space needed.
Right.
So we never got to unsafe numbers. But that's definitely the biggest thing that came out positively from this pandemic.
What do you think as far as people wise? What did you observe from your staff during this period of time, as far as stepping up and I guess you know serving the public to even their detriment?
Yeah. Listen, I was so touched to see how everyone were putting their own lives at risk at the time. Remember, we spent a big period of time without vaccines, and
Right.
I was rounding the COVID units, and I would see our caregivers with those N95 masks, and we all saw those marked faces, from the how tight those masks were for 12 hours. It was very impressive to see how people were risking their own lives and their own families to care for others.
Yeah.
I always worked here. I didn't work from home during the pandemic, as you can imagine. I was here leading, rounding, making sure everybody had all the supplies that they needed, and how the spirit of getting together to rise to the crisis at hand was unprecedented in my career.
I've heard that from almost everybody that I've talked to about this, and it's always the surprise how you knew it, but sometimes you don't see it. How healthcare individuals stepped up where sometimes you would think they wouldn't, but they did.
They did.
And it's really remarkable that you're what I would call, not the executives or whatever, but just your line people, the nurses, the techs, how they all stepped up. Your janitorial stepped up for the patients. To me, it's just an incredible situation and something that hopefully you'll never have to repeat, but is always there with those
It's
people's
definitely a
hearts.
calling, Charles.
Yeah. So as we kind of round up today, wind up today, tell us. I guess, during your career, you've seen young people come and go. I'm sure within your organization. What piece of advice would you give somebody who is just coming out of whether it be undergraduate or graduate, and saying, I really want to get into healthcare. It's such an easy job. The pay is great. The hours are limited. But what piece of advice would you give them about getting into healthcare and
Yeah.
pursuing a career?
Charles, first of all, I will congratulate them because they will be embarking in definitely one of the most rewarding careers that anyone could ever have. I would encourage them to do so. I would tell them to be passionate, to work hard, and always make decisions that will put the patient first. Because when you do that, that will definitely lead to a lifelong career of professional fulfillment and satisfaction.
Yeah, yeah, for sure. And finally, as the last question, because I don't like to answer it myself because I'm not sure what the answer would be. But what keeps you up at night? What get you? Sometimes you get home and you can't just shut down. Some people can, but sometimes you can't. What from your perspective keeps you up at night with having to run a facility like Cleveland Clinic?
Yeah. So I wouldn't say it keeps me up at night, but definitely what I'm always thinking about is how can I lead teams in making the best decisions that affect our patients and our caregivers, right? I want to make sure that our caregivers have all the tools, the guidance, and the knowledge to provide that optimal patient experience while at the same time delivering quality and safe care. But I also want to make sure that the caregivers have the support needed at times of adversity so that they can have the resilience to avoid burnout. Because as you know, that's one of the most pressing things in healthcare today.
So usually that's my final question, but I wanted to ask you to give me the elevator speech on Cleveland Clinic and what makes Cleveland Clinic Cleveland Clinic. There are names out there. You don't have to say anything else. When you say Cleveland Clinic, it people know it. But tell us what Cleveland Clinic is and what it means to you.
Absolutely. So Cleveland Clinic Weston Hospital, Charles, is a unique mid-size hospital here in South Florida. And I say that because we provide care for the sick and the sickest in our market. Cleveland Clinic is the place where people come for complex medical care. We have one of the highest case mix index in our Tri-County area here in South Florida. So we take a lot of pride in that. But more importantly, more than providing top quality of care, which is what we're known for, I am most proud of the caregivers that serve this hospital, which is caregivers that dedicate their lives to care for folks with empathy, that they treat our patients like they were treating their own family. I think that that's what makes this place very special. And it's definitely, and the thing that I enjoy the most is to reading all those letters that I get from grateful patients on how fantastic our caregiver team is at Cleveland Clinic.
Well, that's great. Well, again, I know you have a busy day since you have to wear both hats, administrative and clinical. So, Dr. Blandon, I want to thank you again for your time and personally thank you for your support of South Florida Hospital News and Healthcare Report. And for those out there watching, thanks for watching, and we'll be back with another interview in the next couple of days. Thank you much.
Thank you very much.